Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have TC Randall. He's a nurse and the author of the book, The View from the Wrong Side of the Day, a story about nursing, PTSD, and other shenanigans. He's a Kevin MD contributor and contributed this article recently, an emergency room nurse diagnosed with PTSD. And we're going to certainly get into the book and that article. But first off, welcome, TC.
Welcome, or thank you. Thank you for
So
inviting me.
before we get into that, tell me a little bit about your story and your journey to where you are today.
So I graduated from nursing school back in 2006. It was a second career for me, and I went pretty much right into the emergency department. I worked for 2 years as a student in the emergency department. And when I graduated, I worked there as a medical nurse for about 8 months before doing my specialty training. Then I worked in another emergency department for 11 years. 12 years, and until 2 years ago, which is when I was diagnosed with post-traumatic stress.
Now, was this in a large urban area or a smaller community?
It's sort of in between, actually. The area where I live now it's what we call a hub hospital. So all the smaller communities around funnel to us, and then we send them on to other areas. Like there's a level 1 trauma center just south of us. So we're considered a regional trauma center.
So you share your story in your book, and I think it's a tremendously important topic, but that's something that's certainly not emphasized both in medicine and in nursing. But
Yeah.
can you share some of the events that led up to you writing that book?
Um, I think really the most important thing about it was that I felt that a lot of the things that happened to me along the way didn't have to happen the way that they did. Some of that was my own fault, or not, you know, placing blame, but just saying that there's things that we as nurses and doctors could do differently. But also, there's a lot of systemic um, inefficiencies that work to sort of compound those problems and to make working in healthcare very difficult and very challenging from a mental health perspective. I think for me, I'd been having difficulty for about a year before I went off, and I had no idea what was wrong with me.
Mm.
I found that I was getting angry all the time at work. Um, to the point where I was feeling actual rage at
Mm.
times towards people coming in and things like that. I think, and then I'd go home and the opposite would happen. I'd be sad and crying all the time. Uh, and then the nightmares started. I started having nightmares about work at least once a night. But I didn't have a name to put to
Mhm.
it. And when I talk about things that I could have done differently, I didn't talk about it to anyone, right? I just stuffed it down and kept going. And things just got worse and worse. And then things came to a head on uh, January 15th, 2018, where I had a very difficult day involving 4 very intense resuscitations. 2 of them involved children. And um, I came in the next day and I had a panic attack outside. And I'd never even experienced anything like that before. It was like having somebody sitting on my chest.
Wow. And what kind of support services did your hospital or medical institution offer?
At the time, nothing. There
Mm.
was, it wasn't even really talked about as a problem in the healthcare profession when I went off. Um, I'm sure there were things that, there were there was help available,
Hmm.
but I didn't know what it was. And there was no sort of clear-cut path to that. And also dealing with, our local workers' compensation board was also, they'd never dealt with anything like this. So it was very difficult to sort of get them on board. And I think one of the things that really struck me, and one of the reasons I wrote the book, was because when you're going through a mental health problem,
Hmm.
especially one as sort of acute as I was at the time, having to go through a difficult process to get help when you're not feeling 100% and you're not thinking clearly was a very, very difficult process. And there were days when I just would like curl up into a ball on the
Hmm.
floor.
Now, one of the analogies that you wrote in this book, and that's part of the excerpt that I ran, was like a frog being slowly boiled in water.
Yeah.
And how about your colleagues during that time? Did a lot of your colleagues um, feel similarly?
Oh, definitely. I think since the book has come out, a lot of my colleagues have approached me, and some of them have even expressed a lot of that they had a lot of difficulty reading the book because it was so close to their own experiences. We went through a period where basically everybody left.
Mm.
And I think we reached sort of a tipping point where the amount of senior staff leaving just sort of compounded the problem, and it became sort of a vicious cycle where the more senior staff that left, the more pressure was put on the senior staff that remained. So we were, um, I went from, in our monitored area in the emergency department, I went from a 4-to-1 patient ratio to some days an 8-to-1.
Hmm.
Right? It doubled. We'd have patients in the hallways. We'd have patients off to one side. We'd have patients in our little quiet room area. And you'd be looking after all these people. And you're also trying to mentor the new people coming in. And of course, every time we get a new patient coming in the door, if you have a choice between sending it to the new person
Hmm.
who's got like, a month in, or the guy who's got 12 years in, who's getting the new patient, right? So it just compounds the problem. And so for every senior staff member that burned out,
Hmm.
that got shifted onto the next one in line.
Sure. And I could only imagine now with the pandemic, these
Yeah,
frontline healthcare workers are even pushed more to the
yeah,
brink. And you hear stories about nurses with not enough personal protective equipment. And I think that's certainly part of the
yeah,
exacerbation of the burnout that you're talking about.
yeah.
Now, let's talk about solutions. So, going forward, what are some things that both nurses and medical institutions can do to prevent PTSD in our current healthcare workforce?
Yeah. Well, there's a whole chapter on that in the book where I, like right at the end, where I say, okay, these are all the problems that I've had. Now, these are some of the things I see. Um, I think one of the big ones is, I know your system in the States is different than ours, but certainly there's a similarity in that when it comes to managing healthcare, we tend to um, staff and budget for the best case scenario,
Mhm.
right? So we tend to under budget, we tend to understaff, and as a result, um, we put more pressure on the people that are in there. We need to stop doing that. We need to start planning for the worst case scenario.
Mhm.
Not only is it beneficial to the staff, but it also can save us money because we're spending a huge amount of money in healthcare on just trying to keep up. Whereas if we like overtime, sick time, retraining, there's a nursing shortage going on right now, and I'm a highly trained emergency nurse who's been sitting at home for 2 years.
Hmm.
And the amount of time and energy that they put into training me has been lost as well. So now they're having to pay that money to somebody else to train them. And so I think that's a really big thing that we need to work on. We need to start looking at how we can better staff and manage that. I also think there needs to be very clear cut and defined strategies for people, so people aren't going into it blind like I did, where it's like, here's where you can find help, here's the paperwork you need to fill out, here's who you can talk to, and that needs to be readily available. I think we need screening tools that are readily available. And we need to let people know what the next steps are. We need to educate healthcare staff about what to watch out for and how to approach one another. If I see somebody struggling, do I just ignore it, or do I approach them and go, you know, I noticed that you've been having some problems lately. Do you want to talk about it? Certainly from our perspective as healthcare workers, I think that we need to start talking about it. We need to start admitting that it's a problem and not looking at that as a failure or weakness. I think we have a big tendency in healthcare work as healthcare workers to stuff things down, right? And not, oh no, everything's fine, I'm doing great, and just continue on. We tend to think of ourselves as being there for the patients and the patients only. So our own feelings get sort of shoved to the side. And I don't think that we as healthcare professionals can look after people effectively when we're doing that, because then problems do develop and nobody knows about it, right? We tend to keep silent, and when we do come forward, people tend to sort of back off and shy away, like,
Hmm.
right?
And I think a lot of what you say can be applied to the medical profession as well.
Yeah,
The burnout rate in physicians is 50%, and you talk about the cost of retraining. For every physician that leaves, it
yeah,
costs $100,000 to train another one. And physician burnout specifically costs the healthcare system over $4 billion a year just because of that
yeah,
turnover. And especially with what you said about we have to take care of ourselves first, because if we can't take care of ourselves, how can we be expected to take care of patients? So I think that there are a lot of similarities between what you're talking about in the nursing profession and what's happening to physicians.
yeah.
So if you had a new nurse coming into the field, and you talked about this a little bit in your last answer, but expand on that. What kind of advice can you give to the new nurse that's now entering the profession?
Well, there's a lot of things. First off, I think that new nurses or new doctors or anybody coming into a medical profession, um, in a lot of ways, they're our greatest resource because they're not entrenched yet, right? They're not
Hmm.
stuck in the system.
Hmm.
So they can look at things with a fresh perspective. They can go, hey, this is a problem. They can come up with innovative solutions that we haven't thought of. Um, I know when I was a nurse working in the emergency department, I tended to rely on the students a lot because they're coming in with the latest knowledge and the latest ideas. There were things that we never do in the emergency department, and sometimes they'd come up and I'd be like, "Well, I don't know how to do
Hmm.
that. I've never done that in 14 years." So. Um, and they'd be, oh no, I know, we did this last week, right, in class. So uh, listening to them and listening to their knowledge, I think, and encouraging them to come forward with that knowledge and say, especially around mental health, hey, why don't we change this? Why don't we fix this? Um, I also think that, again, we need to encourage them to talk to people.
Hmm.
I do a workshop with students, and as I said, it's been sort of slow going. A lot of places don't necessarily want to hear what I have to say. But I did one at my own college where I graduated from, and the students there uh, were like, they took that message and they just sort of ran with it. And for the
Hmm.
rest of the day, the instructors at the college were having to talk to students individually, because all of a sudden every one of them wanted to share their story at the same time.
Yeah.
So I think we work in a profession that is rife with uh, things that are going to have an effect on us.
Mm-hmm.
Right? We see some pretty horrible things, or we watch people go through the process of dying. We see all these things that really weigh us down, and we need to start acknowledging that and saying, hey, I've had a really bad day, or hey, I
Mm-hmm.
did this, or this happened, and not worrying about how that makes us look. Right?
So I think one of the things that you said earlier was kind of normalizing it, so
Yeah,
it's less of a stigma, and I think
yeah.
that's fantastic advice. So thank you so much for sharing your story. Now let me ask you, what's your take-home message? What's the one thing that you want my audience to come away with?
I think that we need to open up a conversation on both sides, both from our side as the healthcare professionals and from the side of management. How can we make this better? How can we make it so that we're not losing people all over the place? And certainly, how can we? I just want to make sure that this doesn't happen to other people. Right? That was the big reason I wrote the book, was to get this out there and say, hey, my story does not need to be everybody's story. So I think that's the takeaway message.
Well, thank you very much for sharing. It's tremendously powerful. TC Randall is a nurse, and he is the author of The View from the Wrong Side of the Day, a story about nursing, PTSD, and other shenanigans. Thank you so much for joining us on the show.
Thank you.